How do you care for your heart while also battling cancer? Dr. Eric Yang created the first cardio-oncology program right here at UCLA to help patients understand how to care for their hearts while undergoing cancer treatment. I hope you enjoy my conversation with Dr. Eric Yang. In 2016, you created the cardio-oncology program right here at UCLA. Can you tell me what inspired you to create the program?
You know, I think it was really just, honestly, just a circumstance of having these interesting patients that just fell into my lap. I think, when I first joined UCLA in 2011 out of fellowship, I was honestly just interested in being at a center where I could teach and take care of patients. I honestly was clinically a bit aimless. And then I got in touch with Dr. Patricia Gans and Dr. Jacqueline Casillas, who run the Livestrong Survivorship Group at UCLA. And for those of you who don't know, Dr. Gans and Dr. Casillas are big cancer survivorship gurus. Dr. Gans thought about the concept of a survivor for the cancer patients in the 1980s, even before it was even conceivable about, given how difficult and how prognostically uncertain breast cancer was, she asked these questions of how will women live their lives afterwards and dealing with the side effects. And her group were like, well, would you like to see some of our patients? And at the time I was, not as busy and young, and said, sure, I'll be happy to see some of these people. And just something just clicked, like in terms of all the side effects they were suffering from. They just had all these cardiovascular complaints that everyone just told them that, well, we don't know what's going on with you, or you're not doing all these, you're not doing all the right things to take care of yourself. But, there definitely was something concrete that was bothering them. And even when I started seeing them, I had no idea what to do, but it was still such a fascinating sort of presentation of effects of chemotherapy, of radiation. And now that we know that, now that we know more, now we know that these are real issues and we need to study them, because the cancer survivorship population is going to exceed over 20 million in the next decade, and something about how they presented, how I could try to help them, how I could study them, just really just clicked off this domino effect of me just wanting to embrace first certain cancer patients and eventually the whole cancer population of UCLA. And that's how they really inspired me, just by happenstance, to start seeing these patients. And it's really one of the most rewarding things I do here at UCLA. And we, built it into a program, started establishing relationships with all the cancer doctors throughout the Johnson Comprehensive Cancer Center, and officially the cardio-oncology program, which essentially deals with the heart health of cancer survivors throughout their journey, was officially established in 2016. And it's been going strong since, and it's still, we're very busy and learning new things every day.
What should a patient expect when they come to visit the cardio-oncology program here at UCLA?
So first of all, it obviously depends on where they are in their cancer journey. And, I always assume that there's obviously a lot of stress, there's a lot of uncertainty, and they're already dealing with a very complicated diagnosis if they're in the midst of treatment or they were just given a diagnosis of cancer. Our role here at UCLA is to try to put ourselves as a guide through this very difficult journey, and to make their visits, their testing, and their education as seamless as possible as we try to weave them into, their treatment schedule. We don't want to make them come on separate times for their echo or for their heart treatments or for their diagnostic visits. We work closely with the cancer doctors to try to make sure they can come at a location that is most convenient to them, or maybe at the same time as their treatments, and discuss the plan moving forward of what we can do for their heart.
Many patients that are watching this video don't live in Los Angeles and they don't have access to a cardio-oncologist. What advice or recommendation do you have for them?
This is something that I frankly, me as a cardio-oncologist as well as my colleagues, we understand that this is not just a health issue or a specialty service that only a few people in the cities or major centers can benefit from. And we know that cancer is everywhere, especially out in the community. The best advice I can offer to patients who are going through this journey is that to learn the best they can about their treatments. What are the potential long-term side effects? How does it affect their heart health now? Many of them may already have high blood pressure, diabetes, or some heart issues or coronary artery disease. And what is the best way they can stay with their heart meds so they can continue their treatments? And it's a lot of information. And as we hope to expand our influence through the country, we know that cardiologists are available, but they may not always be knowledgeable about these specific issues. And this is why it's important for patients to advocate for themselves, to say, well, what are the best things I can do for my heart health, depending on the kind of medicines I'm going to get for my cancer? We're almost never going to say you can't get certain treatments, but it's still very important to be educated about the short and long-term side effects. And we have a lot of online resources available at the American College of Cardiology, American Heart Association, and Heartquake as well.
Is there a type of cancer that impacts the heart more than others?
Yeah, that's a very good question. We know that cancer is not a homogeneous disease process. We know certain treatments or certain kinds of cancers can affect the heart more so than others. If you ask the question of what can a cancer do to someone's, lifestyle and their routine, a lot of cancers can unfortunately hurt heart health indirectly, because when you get sick, when you start getting chemotherapy, what happens? You don't eat as well, or sometimes you're told, eat as much as you want, don't worry about what you eat. You stop taking some of your cholesterol medicines or your blood pressure medicines because you're just not feeling well. You exercise less. And these are some of the long-term effects that we know that many cancers may result in. But we do know that there are some cancers, especially lung cancer, which unfortunately still remains a serious cancer, and also blood cancers like lymphoma, leukemia. They're also associated with higher risks of heart disease, both acutely or long-term. We don't know if it's the cancer themselves or the chemotherapies, but unfortunately they do come with higher risks of short and long-term heart attacks, strokes, blood clots, and things like that. So this is something, again, why if someone is high risk, it helps to have a specialist involved to make sure these risk factors are reduced to the best of our ability.
What can breast cancer survivors do to help monitor their heart health?
This is such a dynamic field as well as cardio-oncology, because we're always riding the tidal wave of all the medicines, as you know, that are just being developed by the month that cancer patients can benefit from. Overall, because the survival rates of stage 3 and below are well over 90%, and many breast oncologists regard, anything less than stage 4 to be a curable disease state. To me personally, I think heart health should be emphasized early on, even arguably during treatment. And we know it's a very stressful time for women when they're going through this, but we know that many of them will overall do well. So it's very important for them to stay on track with their risk factors, to keep their blood pressure maintained, to try to eat healthy, to try to exercise. Physical activity, we know yields both short and long-term benefits for breast cancer survivors. And also certain drug classes like anthracyclines, you may have heard the word adriamycin, the chemotherapy that's kind of red colored, that can be associated with short and long-term heart damage. And we also recommend that women that have ever received that chemotherapy to also make sure they get, an echocardiogram or checked every so often by a cardiologist or a cardio-oncologist. If you combine that particularly with, if you have a HER2 positive type of breast cancer, Herceptin or trastuzumab or pertuzumab or some of these other newer agents, those two combined that some cancer patients may receive, that can also be associated with a higher incidence of long-term and short-term cardiomyopathy or heart failure. And now we're seeing in triple-negative breast cancer the use of immunotherapy, which is a very innovative drug class that manipulates the immune system into recognizing cancer and having your own immune system attack the cancer. However, we suspect that there's a very rare chance associated with myocarditis or inflammation of the heart. We do worry about the potential effects of atherosclerosis because there is some early data to suggest that this drug class might make, atherosclerosis or, calcific disease in your vessels worse over time. So there's a lot of, dynamic movement within the breast cancer armamentarium. It's important because, like I said, many of these women will survive breast cancer or live many years with breast cancer. And our goal is to make sure that the risk of heart issues down the line is minimized by early detection, aggressive treatment of risk factors, and trying to maintain a healthy lifestyle.
If there is a patient watching this video and they're concerned about their heart health now while navigating through cancer, do you have any advice for them?
We know, again, the cancer population is wide and varied in a variety of places in the United States with varying degrees of access to cardiovascular care. it's important that you can, to know that you can get the resources you need on a lot of cardiology societies about cardio-oncology. Just look it up. There's going to be a lot of literature available, and you can look up specific websites like at the American College of Cardiology, like CardioSmart, American Heart Association, that can direct you to find out what kind of, based on the cancer treatments you will receive, what are the things to watch out for, and to bring that up with your oncologist. And if he or she thinks it is warranted, to send you to a cardiovascular specialist for monitoring. This obviously is not a guaranteeable action in many places in the country, but it is one of the first steps you can do to advocate for yourself. And also on social media, support groups. We know that cardio-oncology is a rising topic in cancer survivor groups. I have personally received referrals within cancer survivor support groups just for monitoring heart health. And the word is spreading, and it just requires, you to kind of just take notes and take advantage of, the online resources that are now available.
A cancer diagnosis is traumatizing. What can you tell patients who are worried about going to see another physician because they're scared of getting another diagnosis?
I have learned over the years how to be as mindful as I can about approaching them with this. I have told women, maybe because they had a higher calcium score or their cholesterol levels weren't that great, it was like telling them they had another cancer diagnosis when it wasn't clearly that serious. But the trauma they've been through and the trauma of having a deadly disease, the last thing they want to hear about is another new diagnosis. And also another thing that's also very interesting is that even recommending things like blood pressure medications or statins, I feel like a lot of cancer survivors, in general, view the treatments they had as necessary poisons. It's they knew that it was needed to defeat their cancer, but also it came to a certain degree at a price sometimes. And that's not to say these treatments are bad. They're needed to save lives, but they see medicines in that view of saying, well, do I really need to be on these medicines, in potentially long term? And, the way I try to frame it is, you have survived cancer. Our goal is not to, lower your cholesterol. Our goal is to have you live your best life by lowering the risk of you having potentially long-term another debilitating disease. It may not be as deadly as cancer, but it can certainly cause problems like heart failure, like heart disease, like the risk of stroke. The risk of these can be lowered relatively with simple medicines. And our goal here is just to try to find a way to have you, live your best life long-term, because we don't want you to survive cancer only for you to have another problem long-term that will really truly affect your long-term, vitality and your lifestyle unless we jump on it aggressively.
Do you have any tips for patients watching this video who want to be better patients?
As exhausting and as tiring as sometimes a cancer journey can be, both psychologically and physically, is to try to have as much normalcy in your routine as possible. Whether that is just for like a short walk, trying to do activities with your loved ones, with your spouse, your parents, or your children. All those things are just sound activities that can also indirectly, make you more physically and mentally active.
I coined the phrase heartquake or trauma of the heart to try and take away any stigma or shame and blame that goes along with being diagnosed with heart disease. What do you think of that word, heartquake?
Heartquake to me signifies urgency, but also empowerment. Quake is obviously a jolt, right? It's a jolt that in the cardiovascular field, calls the attention that is needed for patients to advocate for themselves, to empower themselves to learn about their heart issues, their heart disease problems. And we know, especially in the female population, this is an understudied, underappreciated disease that can come in multiple forms that are underrecognized, underappreciated. I would say in my field, in the cancer population, unfortunately, it is indirectly also ignored because all the focus is on the cancer, understandably. But at the same time, people like me feel that if we spend more time also on heart health, we may be providing better outcomes for our cancer survivors better than we think, because it's not necessarily just about the cancer. It is also about the risk factors that lead to both cancer and heart disease that we can hopefully prevent and lower the risk of.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.